What they want to see in the NHS job application is whether you meet the job specification requirement. So don't tell us a long story. Nobody cares. They just want to see whether you are compatible with the job specification. Otherwise, you can forget about the job. Forget about the job. Hey guys, welcome back to my channel. I hope you're all doing well. Thank you so much for joining me once again back onto my channel. My name is Belinda, and if you've not already subscribed, please go ahead and press the subscribe button as well as turn on the notification bell so you get a notification every time I upload. This is a nursing-based channel, all things nursing, as well as other bits and pieces as well. So today, as you read from the title of this video, this is another nursing-based video. So today guys, for this video, I'm basically going to be showing you guys how to apply or go ahead and do your application for a newly qualified job on the NHS website, because I just thought it would be interesting, especially if you are in your final year, or even if you're not in your final year, this video can still be applicable to you or any sort of job under the NHS. This will be a very interesting video for you. So first thing you want to do obviously is go ahead and press your Google website, and then you go on the NHS job. NHS job, you can put that in. So you go on, it says www.jobs.nhs.uk. you go ahead and press that. So obviously I'm accepting that. So if you have already got a login, you can go ahead and press your login, put in your address as well as your password. However, if you don't have a login, you have to go ahead and register your details. However, I've already got an account, so I'm just going to go ahead, and my email address and everything has been saved already, so I don't have to worry about that. And then I'm going to go ahead and log in. Okay. So initially I just thought that this would be an interesting video to create, because the thing is, I remember when I first applied for the very first NHS job, which was a bank healthcare assistant job, it was really complicated until you get the hang of it. However, once you are in and you know how to manage it, then it will be more of understanding, if that makes any sense. So obviously I logged in. You've got terms and conditions from the 21st of January that you have to read in. Obviously every time things change, so I'm just going to go ahead and say I agree, because obviously that's what happens. So wherever you are staying, so if you are here, you say newly qualified, so newly qualified nursing jobs. So obviously depending on the area as well as your location, as well as on what kind of job you're applying for, this is the route you're gonna go. So once you reach your home page, like I said, then the keywords or job reference would be newly qualified nursing jobs, and then the area that you are staying in. So search jobs. So let me show you guys, for instance, if I can find one. So here, for instance, here you've got newly qualified preceptee nurse, newly qualified preceptee nurse, and so on. However, don't necessarily have to apply under those. You can apply just under a normal job, and afterwards, once they receive your application and they see that you are a newly qualified registered nurse, or you are in the point of being a newly qualified registered nurse, they will go ahead and take your application, and obviously they will just find you a job that is more suitable in regards for a newly qualified nurse, because certain jobs that you do apply, they require a certain amount of experience. I think I've mentioned this in my other video before, that I applied obviously in ICU, intensive care unit, and they wanted me to have at least 6 months of nursing experience prior to applying for that specific job. But anyway, so that's the job, and then I'm gonna go and press my application. So it closed on the 11/08/20. Like I said, this is a newly qualified registered job, obviously in the trust that I said, or I mentioned before. I'll leave that video somewhere up here. So we're gonna go ahead and look at the job description as well as person specification, because those two are very important prior to applying for a job, you know, just to have some sort of idea. So the post is a registered nurse, and it's a band 5, obviously we all know that. Job summary, obviously you report responsible to the ward sister as well as the ward matron. So job summary, the role of a registered, the role of the nurse is to provide holistic care, blah blah blah. You know what the job role is or job summary is by the title of the post. Okay, so it's a registered nursing job, so that's the job summary. So in the job summary it talks about the 6 C's. If you're a nursing student or already qualified, you should have some sort of knowledge about that. Okay, and then it talks about the main duties as well as responsibilities. So, you know, act responsibly as a team member, seek help whenever necessary, implement relevant clinical assessment tools and risk assessments, work within the limitation of your competency. So as a newly qualified nurse, it is very important to work within your own scope, because many people go abroad and beyond, especially if you don't have that confidence yet. It is okay to say that you need help to some certain extent. This basically tells you what are your duties and then your responsibilities, which is quite a lot. So, you know, read through that. Education and practice development, so they're talking about training, keeping your training up to date, so on and so forth. Then you go underneath statutory, so that would include anything to do with your DBS check. So obviously in order to work in care, your DBS has to come back clear. So we have discussed that, confidentiality, blah 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 blah. And then at the bottom here, guys, it's very interesting to read this, our story. Every trust has their different motto. So obviously the reading this, you know, in regards to the values of the hospital or the values of the trust, will help you when you have your interview. Because I remember when I had my nursing job interview, everything that's being said here is what I mentioned in my interview, you know, so that the people can have some sort of knowledge that I did do my research for that specific hospital, as well as the value that they stand for as a trust. So that was the job description. Then under person specification, obviously you pull up this folder. Let's go under that. So once again, it tells you the post, it tells you whatever the area, blah blah blah, and the salary. Obviously if you want to know the starting salary of the post, they normally say it at the beginning. So as a newly qualified nurse, it would be between 24,907 at this current point in time, and between that. But obviously as a newly qualified nurse, that's the starting salary. So if you read if you just tilt your head a bit, you've got the 3 columns shortlisting criteria. So you've got your desirable, important, as well as your essential. So obviously this is a nursing job qualification, so you have to have your NMC registration. So like I said, you don't necessarily have to have it at that point in time. However, if you are working towards your nursing, where you just have a few months left prior to you becoming a registered nurse, you obviously need, which is very essential, you need to be registered with the NMC. You need to have a diploma or degree at some point. Mental qualification, you won't have any at that specific point in time because you are newly qualified. You later normally get that later on, and that also applies to leadership qualification. Previous healthcare experience, you should be able to have that. So now many people will be like, well, I've never worked in healthcare before. However, you going on clinical placements while you're doing your nursing degree can also come up as essential healthcare experience, if that makes any sense. Evidence of post-registration qualification, that is not necessary because that doesn't apply to you as such, because you are working towards your degree. Commitment to continuing professional development with an enthusiasm, that is obvious. As a nurse, you never stop learning, you continue learning, so you continue making sure that your training is up to date. You continue doing your e-learning, obviously, and all these online trainings, as well as mandatory trainings that you have to attend. So that one we already know. Awareness and understanding of current issues within nursing, midwifery, and whatnot. It is not necessarily an essential thing, but it is a good thing to have. So now with this information, guys, let me zoom in for you guys. With this part, awareness and understanding of current issues within nursing, midwifery, and wider NHS is of great essence. Like I said before, in my other video where I had my applying for a newly qualified registered job post, I did mention that if you are having an interview, it would be of great benefit to know about the current events that is happening in the healthcare sector. which shows that you've got some sort of knowledge about what's happening with the NHS. I mean, like right now, the biggest discussion within the NHS is, besides the vaccine obviously, would be the 1% pay rise that they said that nurses are going to get. So 1% pay rise, guys, would be about 30p on top of your hourly salary, which is not actually much. It's not much at all. But anyway, that is a current topic that's happening within the NHS. So let's go back. Then you have to talk about your skills, the ability to communicate with the patient. That is of essential. You have to be able to communicate with your patients as well as with your fellow colleagues. So these are just your skills to demonstrate accuracy in verbal and written. That's very important. If you go into the NMC website, you can have some sort of look on how people actually get struck off or suspended from the NMC if they don't show some sort of competence in regards to the English language, both written as well as verbal. That kind of sort of information is actually quite interesting, you know, just to quick read. So the ability to make judgments, obviously that once again proves your competence. Assessment of a patient's condition, that is one of the most important things that you have to have as a nurse. Apply to assess, plan, implement. The ability to work as part of the MDT, ability to allocate and delegate workload, responsibility, clinical supervision of junior staff, so HCAs and that. The ability to make changes to own practice and offer suggestions for improving services, very important, because you can make adjustments if something is not working for you within a team. And then once again, at the essential comes the values and behaviors. So compassionate, accountable, respectful, as well as engaging. Those are basically essential factors for the various job specification of this post and of this hospital. Like I said, it depends from hospital to hospital. I don't really want to go into detail as such with this because I just wanted to show you guys the importance of reading your job description as well as your job specification, so you guys have some sort of knowledge when you go ahead and you fill out your application. Okay, so obviously that's that. So the one that I really want to show you guys is your profile. So basically from your profile, guys, this is what you're going to use to apply or send a direct application for your job. So for the first one, obviously, it's all your personal information, you know, your national insurance number, address, and so forth. Okay, and then you've got at the bottom here, let me zoom up, is your preferred employment type. So if that job is a full-time job, guys, and you are looking for a part-time job, my advice to you is don't apply for that, because they specify whether they are looking for full-time, which is 37.5 hours, or part-time. So that's your personal information. Qualifications then, guys, would be obviously previous qualifications that you have obtained. So and then afterwards here, what I would put is access, I don't know if you guys can see this, access to higher education, and grade obtained, diploma, year, which year was it, 2018 I believe, and place of study, Tresham College. So that would be that. Then I would add another qualification, and the next qualification I will put the BSc, and then I'll put the honors, close brackets, and I'll put the adult nursing, and then they will put the Montfort University, because that's the place that I'm studying at. And then I'll put here 2021, and then I'll put here degree. So that is that. Training course attended, I'm not putting any training as such, because as a newly qualified nurse they will provide you with all the training, so I'll leave it at that. I normally put here under qualification. In regards to membership of professional bodies, let me try and make it bigger for you guys so you guys can have a look. In regards to membership of professional bodies, if you are still a student qualifying, this at this point doesn't apply to you. However, once you become registered, then you will say I have a current UK professional registration relevant for this post. So you'll normally go ahead and apply that. However, if you are still a student, you would still say I am a student and go ahead and save that. Then here you will put all your employment history, so obviously from the latest up to the current. I'm not going to really do that in details because, you know, whatever, but you would put all your employment history and so on and so forth. We all know that one. That one is easy anyway. And explain reason for leaving. So normally the best thing to do when you type reasoning for leaving would be to pursue new opportunities for growth. That would be that's what I use, and I think that's a good thing to use, you know, because you don't want to put the leaving a job because I'm not getting along with the manager. That doesn't come across as a good light on you, so we try and avoid all of that at that point in time. All right, so we finished that as well. Employment history, we're all aware of it. And then referees. So if you're a student applying for this post, the references that they would normally want you to have is firstly your mentor's reference. So your mentor on a clinical placement setting, to say that, you know what, they acknowledge you as a newly qualified competent nurse. Like for example, I am still waiting for a reference. People say you normally have to wait until your management placement to obtain a reference. However, that's not the case. You can obtain a reference the minute you've got a mentor who can vouch for you. The second reference I would ask from is a reference from the university. So any sort of reference from the university from your mentor. I got in touch with my mentor. He actually told me something very interesting. He says that they don't do references directly, the university does it on their behalf. So the universities can deal with that, just to acknowledge that you were a student, or you are currently a student at that university, and you are undergoing the course that you say that you're undergoing. So that's what they need as well. Supporting information, let's go ahead and have a look at that. So in this section is the biggest section, guys. Now the reason I actually wanted to do this video is specifically for this section, because this is the section that you say supporting information. So please include reasons for applying and taking the job opportunity to highlight your particular skills. So let's make that bigger so you guys can have a look what I'm typing. So basically in this section, guys, we're going to include everything that we have read in the job specification as well as the job description, because when they read the information and they look at the job specification, they're going to see if it actually matches and correlates. So in the job specification, we talked about communication. Okay, let's refix that. So we spoke about they wanted somebody who has effective communicational skills. So we're going to mention that. Secondly, we're going to mention about all relevant skills that you have obtained throughout clinical placements. We're going to talk about that. In addition, so normally when you apply for your newly qualified job role, they're going to ask you 3 specialities that you would like to work in. So in addition, mention the 3 top nursing specialty, okay, that you would like to work in, e.g. surgical ward, A&E, or cardiology, etc, etc. So mention that. Then in your application, it's nice to see that you have some sort of knowledge of the 6 C's. The 6 C's, guys, like we said. If we open the job specification, guys, we are looking at the nursing 6 C's that are mentioned here. That is what they need. Let's close this again and open the specification, because this is what we are writing according to. And then we're going to talk about what it means for you, what it means to you being a nurse. Why are you you suitable for this job. So include, once again, back to the specifications, include that you have the ability to work in a multidisciplinary team. You are able to be very organized. So basically all of these here are just some sort of examples that you can mention as to why you are good for the job. And then back in reference, go back to that you are compassionate, you are accountable, you are respectful, as well as you are engaging. So guys, this is just, like I said, an example in regards to this very job application for this hospital. So that's that. And then you would conclude. Obviously you don't have to add a lot in here, guys. Just go straight to the point as to why they should give the job to you, what you have learned on your clinical placements that you feel like you can use once you get the job, and also specify what specific ward you would really like to work in. So I think this is the part where many people don't really know what they can write, but yeah, that's just basically that. And then you go next to the next one is monitoring information. So you go under this section. Obviously it's just a brief equality and diversity monitoring, so the Equality Act 2010, obviously a bit of information, and then you have to agree, and then you have to continue. Then here again is the Safeguarding Rehabilitation Offenders Act, and so on and so forth. And then you save and exit. So basically that's just how you have to write the information. The reason I wanted to show you guys this is because I know it can get quite confusing writing, or rather doing this, because I found it very confusing, especially when you don't know what sort of information to put in. But like I said, when you are writing that specific supporting of information, go back and check your job specification, and whatever is essential in your job specification, put that in your support information and add a bit of your own touches to make it sort of relevant. Talk about as well as any sort of healthcare experience that you've been able to obtain throughout the course, if you've got any. And this, guys, is just what I wanted to show you guys. I feel like, you know, this, guys, is not only for newly qualified nurses, it is the way you apply for any sort of job within the NHS. So this was just an example for me to show you guys how to basically apply for this job, just for future references. So if you are either in your third year and you're looking into applying, or if you are thinking about applying, or you haven't reached at that point but you obviously going to get there and you're going to apply for the job as well, you can go ahead and follow this procedure, guys. Okay guys, so this brings me to the end of my video. I hope you like it. I hope you found this video very interesting as well as educational. And if you like this type of video, please don't forget to comment, like, and subscribe. And I will hopefully see you guys in my next video. Bye.